start this morning by recognizing the difficult moment we are in with this pandemic. The Omicron variant has caused an unprecedented number of infections across the country over the past month. Thanks to the hard work of so many, we have new tools to address the threat caused by this new variant, including vaccines, boosters, and high-quality masks. But the sheer number of infections is putting an enormous strain on hospitals, healthcare workers, schools, families, and communities across the country. We all need to do our part to address this new challenge by getting vaccinated and boosted and wearing high-quality masks. That is why we are having this hearing in a larger hearing room where we can be socially distanced, limiting the number of people who are here in this hearing room, and taking additional measures such as wearing masks. I will be wearing my mask during the entire hearing and would respectfully request others in the room today do the same. As always, I appreciate the work from the staff of the Sergeant-at-Arms, the Architect of the Capitol, and our committee clerk and his staff to make this hearing as safe as possible. Nearly 2 years into this pandemic, people are exhausted after all we have been through. And even as the Delta strain is still circulating, we are all alarmed by how quickly Omicron has spread and anxious about what is next. People back in my home state of Washington and across the country are frustrated and worried about the course of this pandemic and its persistent challenges, like how hard it still is to get a test. I've heard from so many people who are waiting in long lines and going from pharmacy to pharmacy trying to find a test, or who are giving up on getting tested because tests are unavailable or cost too much. I've also heard from people who have found the communication about new isolation and quarantine guidance confusing and frustrating. They are trying to keep themselves and their families safe as this pandemic evolves and we continue to learn more. But I'm hearing more and more questions like, what kind of test should I get? When should I get tested? Why can't I find a test? Do I need to isolate 10 days, 5 days, or even at all? Testing in particular is a huge concern for parents who are starting 2022 exhausted from the last 2 years and worried about schools staying open safely this year. I know what a struggle it is for parents scrambling to figure out childcare when they've got to go to work, or how tough it is for kids to keep up with classwork while transitioning back and forth from in-person to online learning. And while most schools are still safely open for in-person learning, and we all want to make sure they stay that way, we know schools are struggling with this, especially as Omicron creates new challenges. I'm hearing from schools in my states that they're worried they'll have to shut down again if they can't get the support for testing they need, or they have staff shortages because of staff who are ill. Nobody wants that. And based on what we now know about this virus and the tools we have to fight it, schools should be able to stay open safely if they have tests, masks, ventilation, and people are vaccinated. Hospital and healthcare providers are worried too. They've been stretched thin after 2 exhausting years, and now Omicron is causing the worst surge in cases and hospitalizations yet. Because while it may be less severe in most cases, especially for those who are vaccinated and boosted, it is so much more contagious, meaning we are still seeing high rates of hospitalization overall. And we also have to protect children who are too young to get vaccinated, and people with health conditions and disabilities that put them at high risk. Back in my state, hospitals are asking our state leaders to declare a crisis for our medical facilities. I've heard from healthcare providers in Washington who have been well over their staffed bed capacity for several days and are pausing non-essential procedures. Families are wondering whether they can get care for non-COVID related conditions and alarmed by how long ER wait times are getting. Healthcare providers are concerned about how we continue to keep healthcare workers safe and also address the fatigue and burnout and mental health challenges that they face. These are not new challenges. I've been raising many of these concerns since the earliest days of the pandemic. So I'm frustrated we're still behind on issues as important to families as testing and supporting schools. That's not to say we have not made progress. It's just clear we haven't made enough. But even though we aren't where we need to be yet, we are not back at the starting line when it comes to COVID-19 either. We have safe and effective vaccines for everyone ages 5 and up. We have booster shots available for those 12 and up. More and more people are getting their shots each day. The administration is also working to help get the world vaccinated to end this pandemic and has already pledged over 1 billion vaccine doses to that effort. We have new life-saving therapeutics. We have additional resources Congress passed in the American Rescue Plan, which can help increase our testing capacity, protect workers, and give schools the support they need to stay safely open. And we have an administration that is focused on following the science, facing this pandemic head-on, and addressing the frustration people are feeling. That is crucial at this moment when the path forward requires steady leadership and clear communication about the challenges we are still facing and the work ahead to tackle them. President Biden has said plainly that he shares families' frustration around testing, and he wants to make sure schools stay safely open. And he has announced steps to address these challenges by making 500 million tests available free of charge, ordering over 200 million courses of antivirals, expanding manufacturing to be able to make hundreds of millions of tests a month, providing schools with guidance on how to test to stay protocols which can help keep students in the classroom, standing up more testing and vaccination sites across the country, and providing medical personnel to struggling areas. I expect to hear more detail on those efforts today, along with what other steps the administration plans to take, and I will be watching closely as they are implemented. But I also want to be clear, when we talk about these problems, we have to be focused on solutions. You can't just say our schools must stay open if you don't vote to provide additional resources schools need to do so. You can't just say the latest health guidance is confusing and not call out the blatant misinformation that has come from so many members of the Republican Party. We are not going to get out of this crisis by treating each challenge as a political opportunity. We are going to get through it by being honest about what we are facing and clear about what we are going to do about it. And as we continue working to get through this pandemic, it's important we also look at what we can do to prevent future health crises. That is exactly why Senator Burr and I have been working in a bipartisan way over the last several months on legislation to learn from and improve on our pandemic response, like strengthening our supply chain for medical products, updating old and incompatible public health data systems, modernizing the process for developing tests, fighting misinformation, addressing root causes of health inequities, and more. We will be unveiling a discussion draft soon, and I look forward to working with all of our colleagues to finalize and pass this important package. In the meantime, we will continue working to address the pandemic at hand. People across the country are worried this will be another year of uncertainty for their work, their schools, and their everyday lives, but there's no reason it should be. People should be able to make plans for the future without fearing that everything they are looking forward to, or even the everyday things they used to take for granted, will be upended by this virus. We all want that, and we have the tools we need to get us there. We have the tools to get everyone tested quickly, easily, and for free, to keep schools safely open during the Omicron surge and beyond, to keep workers, especially our healthcare workers, safe and healthy in the workplace. We have the tools to mitigate this virus, to protect those at high risk, like seniors or kids who are too young to get vaccinated, and people with other health conditions, to get people back to their friends and their lives, and to give families back some certainty and stability. We can do all this now thanks to the incredibly hard work on the part of healthcare providers and scientists, parents and teachers, workers, and our witnesses who are here with us today. So what I hope to hear from this administration at this hearing is, what are you doing right now to make sure every American can make use of that progress they've worked so hard for? What can my constituents expect to see improve this week and the week after? We've come a long way since the start of this pandemic, and I look forward to hearing from each of you today about what you're going to do to build on what we know, bring this virus under control, and bring certainty and stability back to families who are burnt out after 2 years of fighting this pandemic. Thank you, and with that, I will turn it over to Ranking Member Burr for his opening remarks.
Madam Chairman, thank you. And before my opening statement, I hope the chair will indulge with me for just a second, since this is a hearing on preparation. I want to help my good friend Senator Kane as he gets ready for his weekly travels. I want to make sure that he's got an orange for his car, that he's got a Dr. Pepper, and I've provided a Lumbee blanket to make sure that these are three things you've got in your car regardless of what you run into on I-95, and I'll have my staff bring them over to you.
I hope you provide those for everyone. As we used to say to our kids in the classroom, do you have a piece of gum for everyone?
Well, in his particular case, I think he's the only one that makes that trip on a weekly basis. Tim, we're sorry you had to spend 27 hours, but you're now qualified to be the Secretary of Transportation if you're looking for a second job.
Thank you. It's sad when a career in the Senate's most notable highlight is my long commute, but...
Madam Chairman, thank you for holding this hearing. To our witnesses, welcome back. Today is going to be a tough hearing, but the American people deserve accountability and transparency. I appreciate that all of you have cleared your schedules to allow multiple rounds of questions today. Next week marks 1 year of this administration. It also marks 2 years since the first COVID case was confirmed. President Biden said in his first, second, and third priorities would be bringing us out of COVID pandemic, and that his team would shut down the virus. This administration was lucky. It started off on day one with the tools to change the trajectory of COVID response. Operation Warp Speed worked with the private sector to bring us groundbreaking vaccines and treatments in record time. Although we had a very bumpy start with testing early in the pandemic, we successfully built some strong partnerships with the private sector to support the development and manufacturing of more tests. State and local leaders were rising to the challenge of testing and vaccinating their citizens. There was reason for hope. Instead, now, a full year later, here's where we are. More than 830,000 deaths caused by COVID, the majority of which occurred under this administration, despite having many tools and significant resources from Congress, including $80 billion plus for testing. A variant is now spreading out of control across the country, with places like Washington, D.C. seeing a staggering increase in case counts over the holidays, and now my state of North Carolina is following suit with a 319% increase as of yesterday. Over the holidays, when Americans were instructed to do the responsible thing and get tests before they see loved ones, there were no tests on the shelves or online, and hours-long lines were the norm at testing sites across the country. The testing situation was worse when many sought tests to safely return to work or to school. And the most vulnerable Americans who contracted the virus could not get the treatments designed to help because they were now in short supply. This administration has time and again squandered its opportunities and made worse in the decisions you've made on testing and treatment, and most crucially, in communications with the American people. The American people are right to be confused. It seems like you all don't talk amongst yourself. Some examples. Last August, the President announced that boosters would be available to all vaxxed by the week of September 20th. 3 of you here today signed that statement, but neither the FDA nor the CDC had yet approved boosters when the President made the promise. And when you went to your advisory panels with a predetermined outcome already made, those independent experts pushed back and ultimately had to be overridden to meet the President's goal on boosters. I know the data shows that boosters are necessary. I'm boosted. I want everybody to get vaccinated and boosted. The facts about the value of vaccines and booster are crystal clear. But the way this administration rolled out boosters was a disaster. You created skepticism and mass confusion. Example 2, last summer the President dramatically announced that CDC recommendations changed so that vaccinated Americans didn't need to wear masks indoors, implying that the worst of the pandemic was behind us, even as the Delta variant was exploding in India. Only after Delta hit America did CDC begin to take it seriously, and the administration had to change course. Example 3, last week Dr. Fauci said that the CDC was going to update its guidance on quarantine. He left the American people with the impression that CDC's guidance was going to include some testing component to reduce the quarantine to 5 days. But when CDC did update its guidance, there wasn't a testing requirement. Again, I'm not questioning the science, I'm glad you refrained from testing mandates, but I'm questioning your communication strategies. It's no wonder that the American people are confused. When the President announced on December 21st that 500 million tests were going to be purchased, he left out that the contract wasn't going to be signed for weeks, and it would take even longer for those tests to materialize. Immediately, other experts and medical professionals were asking what the value of just 1.5 tests per person was when CDC's own guidance said that you need multiple at-home tests to be assured of the results. Yesterday, the administration mandated that insurers now cover the 170 million Americans that are covered by private insurance. They must cover up to 8 tests per person per month. That would be 16 billion tests. And we have 500 million today that are aspirationally going to be contracted for. It's still unclear when these tests will be available, how to get them, whether any more are on their way. But it's especially frustrating that the White House press secretary had previously mocked the very idea of doing what the President later announced. In a sarcastic and withering tone, when this was first proposed, she had 4 questions. Whether we should just send one to every American, then what happens, how much does it cost, what happens after that? Those are all good questions that remain unanswered by the administration. My final example, though there are many to choose from, happened last week too. The White House press secretary, a repeat offender in poor communications, was asked about boosters. The press secretary said, and I quote, "They can get boosted now regardless of what CDC guidance is, whether you're just approved or for a booster or you've been approved for weeks," end quote. Regardless of what CDC guidance is. From the White House podium. And then I was amazed when I got home on Sunday and I had this letter from the Centers for Medicare and Medicaid Services telling me as a Medicare beneficiary that I'm eligible to get a free vaccine booster. 5 months after the President announced we were going to have boosters, this is the first communication from CMS that I've gotten as a Medicare beneficiary in the 2 years of COVID, and all of a sudden I get a request to get boosted. When a Republican governor or a senator, including some on this committee, suggests concerns about CDC guidance, Twitter and MSNBC can't react fast enough with scorn and anger. So it can't come as a surprise that there is confusion and anger when the White House says to ignore CDC guidance. I tell my staff, as I've repeatedly said to you in all previous hearings, to look 30, 60, 90 days ahead. Look 6 months ahead. Look abroad. See what's happening in Asia, Europe, Israel, Africa, UK, and elsewhere around the world. What do we need to anticipate? At our hearing on July 20th, I warned that Delta would not be our last variant. And I pleaded with each of you to have a plan in place for the next mutation of the virus. So why was the Vice President surprised that Omicron came to our shores? Well, I'll say it's very clearly, so the administration does not, yet again, say they're surprised. Viruses change, viruses mutate. There will be more variants. They will come to America, period, end of sentence. I don't understand why after tens of billions of federal dollars being appropriated, this administration has failed to ensure that the Americans have the tests they need. I don't understand why suddenly it's okay to take into account the economic and job impact of your guidance and recommendations. You shortened quarantine guidance because too many people would be out of work. Was that because of science, or was it because you now know that lockdowns, shutdowns, and school closures come with a significant downside impact? You ask the American people to trust you. Quite frankly, you've lost their trust. Rather than attempting to gain their trust back, the administration chooses to litigate mandate requirements for employers with over 100 employees. I've asked before, what's the plan? Never gotten a response. Very seldom do I get a letter responded to by this administration. The administration's not responded to my letters. Maybe folks at the White House don't think they need to respond to Republican senators. I think my record shows I'm approaching all of this as I have for the last 20 years. I'm trying to help. I love this country, love its people, and I know we can do better than we've done. I know we have to do better. Maybe I'm wrong about this. Maybe you'll tell me where I got it wrong. Instead, I'm hoping that you'll understand that my criticism comes from a place of concern, because the communication efforts are a mess and have only made things worse. Now, I admit it. I'm at the end of my rope. I think you'll see today that most of my colleagues are as well. I've tried to give my best advice and share what we hear and what we see, because no one's paying attention to the message from this administration right now. Maybe today you respond to my request to learn what the plan is. Hopefully you'll take this challenge to rebuild the trust, not just with me, not just with my colleagues, but with the American people we all serve. What are you changing in fiction to restore the confidence with the American people that there is a strategy for testing, for treatments, for fixing your communication strategy? Because if you don't, things are going to get worse before they get better. Madam Chairman, I yield back.
Thank you, Senator Burr. We will now introduce today's witnesses. Dr. Rochelle Walensky is the Director of the Centers for Disease Control and Prevention and the Administrator of the Agency for Toxic Substances and Disease Registry. Dr. Anthony Fauci is the Director of the National Institute of Allergy and Infectious Diseases and the Chief Medical Advisor on President Biden's COVID-19 response team. Dr. Janet Woodcock is the Acting Commissioner of the Food and Drug Administration. Don O'Connell is the Assistant Secretary for Preparedness and Response. And Director Walensky, Director Fauci, Acting Commissioner Woodcock, and Assistant Secretary O'Connell. I want to thank you all for joining us today. We all look forward to your testimony, and we will begin with Dr. Walensky on your opening statement.
Good morning. Chair Murray, Ranking Member Burr, members of the Senate Health Committee, I appreciate the opportunity to join you to provide an update on the COVID-19 pandemic and the impact of the Omicron variant. It has been just over 2 years since we were first alerted to the emergence of SARS-CoV-2 in China. And since that time, CDC has worked with our partner agencies and you in Congress to take remarkable action to protect the health and safety of Americans. Omicron is now the dominant variant in the United States, driving case counts to unprecedented heights here in the United States and around the world. Despite the increases in cases, there are promising emerging data from South Africa and the United Kingdom that hospitalization rates for people infected with Omicron are lower compared with prior variants. These data seem consistent with what we're seeing so far in the United States. However, despite a potential decrease in severity, the substantial number of absolute cases is resulting in hospitalization increases across all age groups, including children aged 0 to 4. The emergence of the Omicron variant again emphasizes the importance of vaccinations and boosters, which decrease the risk of infection, severe disease, and death caused by COVID-19. Just last week, we made important progress towards increasing booster coverage through four key actions. First, we expanded eligibility of booster doses to those 12 to 15 years old. Second, CDC strengthens its booster recommendation for adolescents, now recommending that adolescents aged 12 to 17 years old should receive a booster shot 5 months after their initial Pfizer-BioNTech vaccine series. Third, we recommended that moderately or severely immunocompromised 5 to 11-year-olds receive an additional primary dose of vaccine 28 days after their second shot. And fourth, we shortened the recommended time between a primary mRNA series and a booster dose from 6 months to 5 months. Each action increases access to vaccines and booster doses at a time when protection is critical. As we continue to monitor this rapidly evolving virus, we are working quickly to adapt with it. Over the holidays, CDC updated our quarantine and isolation guidance, first for healthcare workers and then for the general public. I know this update has resulted in numerous questions, so I would like to take a moment to walk through it now. For people who tested positive for COVID-19, CDC recommends isolation for 5 days. If you are asymptomatic or if your symptoms are resolving, for example, you're without a fever for 24 hours, you no longer need to isolate. However, you should continue to wear a well-fitting mask at all times when around others, including at home and in public for an additional 5 days. We recommend that you avoid activities where you are unable to wear a mask and that you avoid travel for the full 10 days. In addition, CDC changed the recommended duration of quarantine. Quarantine is what you do after you're exposed. People who are not up to date on recommended COVID-19 vaccines should quarantine for 5 days if they come in contact with someone with COVID-19. People who do not develop symptoms by day 5 should get tested. If you test positive, you should begin isolation. People who test negative may end quarantine and should continue to wear a well-fitting mask when around others for an additional 5 days. These recommendations are consistent with over 100 studies collected over the past 2 years, indicating that people are most infectious during their first few days of infection and significantly less infectious 6 to 10 days after infection. A core part of CDC's mission is to translate science into recommendations for best practices and real-world circumstances. Over the holidays, we saw the growing surge of Omicron and took swift, science-based action to address the very real possibility of staffing shortages in hospitals and in other essential areas of the workforce, including schools, pharmacies, public safety, public labs, grocery stores, and other sites, where shortages could have and have proven to have dire public health consequences. This is the right guidance for what we currently know about transmission and the real-world circumstances we currently face. As we will learn more, we will continue to update accordingly. Omicron is likely not to be the last curveball this virus throws at us, but we have the tools to prevent further spread of this virus. This means for everyone 5 and older, please get vaccinated. For those 12 and older, get your booster shot. And please continue to adhere to the multi-layered prevention measures, including masking and, yes, washing your hands. Thank you, and I look forward to your questions.
Thank you. Dr. Fauci.
Madam Chair, Ranking Member Burr, members of the committee, thank you for giving me the opportunity to discuss with you the role of the National Institute of Allergy and Infectious Diseases in the conduct and support of research addressing our nation's response to COVID-19. In our most recent hearing before this committee on November the 4th, I discussed the importance of booster shots to enhance immunity against the Delta variant that wanes over time. Indeed, booster shots have dramatically reconstituted the waning immunity and has increased protection over and above the original level afforded by the primary vaccine regimen. Today, we are faced with a different challenge, a new variant called Omicron that has rapidly spread throughout the world, including a massive, unprecedented surge in the United States. This variant possesses a large number of mutations that are associated with an increased efficiency of transmission, immune evasion from certain monoclonal antibodies, convalescent plasma, and antibodies induced by our current vaccines. Thus far, data from our own laboratories at NIAID, as well as from laboratories throughout the world, have indicated that vaccine-induced antibodies lose a considerable amount of potency in neutralizing the Omicron variant. Although this is of obvious concern, the encouraging news is that a third shot boost of an mRNA vaccine significantly reconstitutes and enhances the ability of antibodies from boosted individuals to neutralize the Omicron variant, strongly suggesting that boosters will play a major role in protecting our population, at least from severe disease, in the context of the ongoing massive surge of the Omicron variant that we are currently experiencing, underscoring why it is so important for the unvaccinated to get vaccinated and for those who are already vaccinated to obtain the booster shot. Therapies in general are an important part of our armamentarium against COVID. In this regard, the NIH has been heavily involved in the development and/or clinical testing of several effective monoclonal antibodies against SARS-CoV-2. However, we have ascertained that certain of the authorized monoclonal antibodies are negatively impacted by the Omicron variant. Direct antiviral therapies also are an extremely important tool in the fight against COVID-19. Importantly, it appears that the mutations expressed by the Omicron variant do not interfere with the oral antiviral drugs Paxlovid and Molnupiravir that NIH-funded investigators played an early role in developing and that have recently received emergency use authorization from the FDA. Nor do they appear to interfere with the FDA fully approved drug remdesivir, shown by NIH-sponsored studies to be highly effective in preventing severe disease. Looking ahead in the context of the inevitable continual emergence of new variants, the importance of developing a pan-coronavirus vaccine, namely one that would be effective against all SARS-CoV-2 variants and ultimately against all coronaviruses, becomes even more apparent. My colleagues and I recently published a paper in the New England Journal of Medicine emphasizing the urgent need for such an effort. In this regard, we have made significant progress in that direction. We have identified antibodies that neutralize multiple different coronaviruses, and in addition, NIAID has issued new awards to fund pan-coronavirus vaccines at 4 academic institutions. These awards will fund multidisciplinary collaborative teams to conduct research focused on coronavirus virology and immunology, immunogen design, and innovative vaccine and adjuvant platforms, as well as technologies to discover, design, and develop pan-coronavirus vaccine candidates. Finally, I would like to close by looking forward to how we might best enhance our preparedness for what inevitably will be the emergence of future pandemics. The NIAID will play an important role in the multi-billion-dollar all-of-government plan for pandemic preparedness. Our mission is the rapid development and implementation of successful countermeasures against several prototype pathogen families of viruses that threaten the health and safety not only of our nation, but of the entire world. Thank you for your attention, and I would be happy to answer your questions following the presentations.
Thank you. Dr. Woodcock?
Good morning, Chair Murray, Ranking Member Burr, and members of the committee. Thank you for the opportunity to testify. FDA's thousands of employees remain steadfast in fighting this pandemic. Our work continued during the holiday season and led to critical advancements in combating the virus. The agency has been closely monitoring the potential impact of the Omicron variant on the currently available vaccines, diagnostics, and therapeutics. I'll provide a brief update and actions the agency has taken in these 3 areas since I last testified before this committee. First, regarding vaccines. The currently authorized and approved vaccines remain highly effective at preventing serious outcomes associated with a COVID-19 infection, including hospitalization and death. Additionally, data evaluated by the FDA suggests that an additional booster shot following the completion of primary vaccination series provides further protection against these outcomes. Following these data, FDA updated the Pfizer, BioNTech, and Moderna vaccine EUAs to shorten the time between completion of a primary series and a booster dose to at least 5 months rather than 6 months. FDA also updated the Pfizer, BioNTech EUA, so it's now available for a primary series in children ages 5 and older, and for the use of a booster dose in all individuals 12 through 15 years of age after completion of primary vaccination, as you've already heard from Dr. Walensky, as the CDC followed up on this. The agency also authorized the Pfizer vaccine for a 3rd primary series dose for certain immunocompromised children that are 5 through 11. These vaccines have met FDA's rigorous standards, and the bottom line is getting vaccinated or receiving a booster with one of the currently available vaccines is the best thing the public can do right now to protect themselves and those they care about. It is not too late to get vaccinated or get boosted. Second, diagnostic tests, which are another key line of defense in this pandemic. Increasing access to accurate, rapid, at-home tests continues to be a priority for FDA. Since I last testified, the agency's authorized 4 additional over-the-counter at-home tests, bringing the total number to 15. And the agency continues to prioritize the review of these type of tests. We also partnered with the NIH to establish ITAP, which streamlines validation and authorization of antigen tests with potential for large-scale manufacturing. We expect shorter review times for such EUA requests due to our partnership with ITAP. In fact, the first 2 tests that participated in this program were authorized in 2 days or less from the time FDA received the final data. So this is a very good model for government assistance of diagnostic manufacturers. In this new program, ITAP will prioritize new over-the-counter test submissions that could be manufactured at significant scale to accelerate the availability of high-quality, accurate, and reliable tests for the public as quickly as possible. Third, as new variants continue to emerge, it's crucial to expand the country's arsenals of COVID-19 therapeutics, especially for those unable to get vaccinated or who can't respond to vaccination. Since I last testified, 3 therapeutics have been authorized for use in the treatment of COVID-19 for emergency use. The first of these EUAs, EvuShield, was authorized for the prevention of COVID-19. The other 2 therapies, Paxlovid and Molnupiravir, as you heard from Dr. Fauci, are the first authorized treatments for COVID-19 in the form of a pill that can be taken orally, which is a major step in the fight against this global pandemic. These authorizations provide new tools to combat COVID-19 at a crucial time, and it should make antiviral therapy more accessible to people who are at high risk for progression. Now, while these are important tools, they're not substitute for vaccination in people for whom vaccination is recommended, and I continue to urge the public to get vaccinated if eligible. And fourth, we continue our mission of protecting the public from fraudulent medical products. Since March, we've refused admission of more than 23,000 lines of FDA-regulated products that we're trying to get into the country illegally. And finally, I want to assure the public that FDA is committed to continue to use every tool in our toolbox to fight this pandemic with the best available diagnostics, life-saving therapeutics, and vaccines. Thank you, and I look forward to your questions.
Thank you. Assistant Secretary O'Connell.
Chair Murray, Ranking Member Burr, and distinguished members of the committee, it is an honor to testify before you today on efforts within ASPR to respond to the pandemic since the emergence of the Omicron variant. When Omicron first emerged, as we have done with each new variant, we immediately evaluated its impact on our current vaccines, therapeutics, and diagnostics, and adjusted our response accordingly. Data suggests that our current vaccine doses with a boost confer protection against Omicron. As a result, we have continued distributing the 3 authorized and approved vaccines. Over 600 million doses of vaccine have been developed and delivered since the start of the pandemic. We have ample supply of both primary and booster doses, contributing to more than 200 million Americans now being fully vaccinated. However, we have had to make adjustments to our therapeutics supply in light of Omicron. 2 of our workhorse monoclonal therapies, one from Lilly, the other from Regeneron, are not as effective against Omicron. As a result, we have increased our supply of GSK's monoclonal, which is effective. We continue to purchase all that we can from GSK, though this supply is still limited. We are on track to have 250,000 courses available this month. A 4th monoclonal by AstraZeneca is targeted for immunocompromised individuals at high risk and is taken prior to exposure to prevent infection. It has retained effectiveness against Omicron, and we will have made nearly 500,000 courses available through the end of this month. All 4 monoclonals are currently available for states and jurisdictions to order free of charge on a weekly basis to treat either Omicron or Delta infections. Also, we now have antivirals by Pfizer and Merck that are effective against Omicron and are being delivered to states free of charge every other week. We have procured 3.1 million courses of Merck that are now available. Last week, we doubled our commitment to order 20 million courses of Pfizer's product. We have 265,000 courses available through this month and anticipate delivering the first 10 million courses to states by midsummer. We remain in frequent communication with states and territorial health officials on the distribution of therapeutic products and continue to focus on ensuring these life-saving therapies are available to Americans across the country. The dramatic rise in cases due to Omicron has put a significant strain on our testing capacity. Despite significant effort and investment, there is more work to do, and we are working every day and night with manufacturers to increase the availability of tests. As soon as we saw the dramatic increase in cases in South Africa and Europe, we reached out to test manufacturers to understand their surge capacity and supply chain constraints. We are engaging daily with the lab test providers to mitigate any supply chain constraints with their sub-tier suppliers. We are also working with the commercial and public health labs to prioritize their needs. We continue to use the Defense Production Act's authorities when needed. To further increase test availability, we are procuring 500 million rapid tests to distribute to American households. As a requirement in this procurement, none of these tests can interfere with what is available in the current commercial market, so as not to diminish what consumers are able to access now. We are currently shipping 2.8 million tests to long-term care facilities per week, as we have throughout the pandemic. We continue to work to send 50 million rapid tests to federally qualified health centers and food banks, with 7 million having shipped so far. And we will keep working around the clock with manufacturers and our government partners to increase and sustain the number of tests available now and in the future. And finally, in addition to vaccines, therapeutics, and testing, ASPR continues to provide on-the-ground support to states and communities in need. Since July, 40 National Disaster Medical System teams, nearly 880 team members, have deployed to 19 separate states and the Commonwealth of the Northern Mariana Islands to support a range of functions, including hospital augmentation and decompression, setting up medical overflow centers for patients, and mortuary support. We continue to send supplies as requested from the Strategic National Stockpile, including 300 ventilators to 6 jurisdictions since the emergence of Omicron. We are grateful for the support from this committee in Congress, and I look forward to answering your questions.
Thank you to all of our witnesses. We will now begin a round of 5-minute questions of our witnesses, and I again ask my colleagues to keep track of your clock and stay within those 5 minutes. As the Omicron variant of COVID-19 continues to spread at an alarming rate, people are looking for clear, straightforward guidance on how to protect themselves and those around them. It is really critical that we reduce the infection rates so we can relieve pressure on our healthcare workers, protect people with disabilities and older Americans, young kids, and anyone else who's been disproportionately impacted by COVID-19. However, I have heard from so many people who find the latest CDC isolation and quarantine guidance confusing and hard to interpret. So, Dr. Walensky, can you please clearly explain CDC's latest guidance on what people need to do to protect themselves and others if they are exposed to or contract COVID-19? And let me start with vaccinated people. What is your guidance to them?
Thank you, Chair Murray, for the opportunity to clarify. Maybe if I could just rewind the clock to just before the holidays, where we were hearing from hospitals that their staff were going out and that they were in a real crunch in terms of beds. They had plenty of beds, but they didn't have staff to staff them. ICU beds were starting to close. So immediately we worked towards our updated healthcare worker guidance. But when we did so, we recognized that we were going to have challenges and that this Omicron surge that we were about to face was threatening many other places of our healthcare sector.
I appreciate the background, but I just want to know, straightforward, If someone is exposed to or has COVID-19 and they're vaccinated, what do they do?
If they are exposed to COVID-19 and they are completely boosted, they do not need to stay home, but they should get a test at day 5. If they have COVID, our guidance does not distinguish between your vaccination status. And our science has demonstrated that you're maximally infectious 2 days before and 2 to 3 days after. So by 5 days after your symptoms, if you're feeling better, if your fever is better, if your cough and sore throat are better, then on day 6, you can go out, but you have to wear a mask. You have to wear a mask reliably, and you should not go to places you can't wear a mask. You probably shouldn't go and visit grandma. You shouldn't get on an airplane.
For vaccinated, what about unvaccinated?
Same for unvaccinated for isolation. So isolation being those who have had disease, who have disease.
Okay. Well, let me just say, nearly 2 years ago, when this committee first started having congressional hearings on COVID-19, the very first thing I asked was, where are the tests? And we've made progress since then, and we are now producing 300 million rapid at-home tests each month, along with ramping up our lab-based testing. But I am disappointed, as I said, by the testing challenges that we're facing. Tests are hard to find. They're costly. People are unable to find the at-home tests in pharmacies, online. They're waiting in long lines, and often after that, waiting days for results. So it's, ineffective at the end of the day. So Ms. O'Connell, I want to ask you, what are you doing to address the frustrations and challenges we are hearing about COVID testing?
Chair Murray, thank you so much for this very important question. Testing remains a critical priority for this administration. When we saw the unprecedented cases of Omicron sweep into South Africa and Europe, we immediately reached out to our manufacturers to understand any supply constraints they had and to evaluate their surge capacity. We have also met daily with them to make sure that they have what they need from their suppliers, and have used the Defense Production Act authorities 12 times throughout this pandemic in support of testing needs. Most recently, in the last few weeks, for 2 tests, we were able to unlock supplies and manufacturing capacity. We continue to invest in rapid over-the-counter tests, which are in high demand. And in the fall, we invested $3 billion to increase manufacturing line staffing and to commit to those manufacturing lines for 13 months. As a result, we went from 46 million tests, over-the-counter tests available in October, to the 300 million, Chair Murray, that you just mentioned that are available now. But that's not enough. We're continuing to bring tests to the American people. As a result, the President has announced, and we are in the process of procuring, the 500 million tests, which every American household will be able to order and have shipped directly to their house. We have completed 4 contracts so far, have secured 50 million tests, and are in the process of securing the additional tests over the next several days. The U.S. Postal Service has agreed to do the distribution, and the U.S. Digital Services is going to help with the website. We anticipate the first test going out at the end of this month, with the remaining tests going out over the next 60 days.
Okay, and I'm out of time, but I do want to just say this. I am hearing from so many schools that are having trouble staying open. They want to stay open. Part of it is they have staff that are sick. That's understandable. But a big part of it is they don't have access to the safety measures like masks and testing supplies. What do I tell them about where they go to get that?
Chair Murray, thank you. Schools having enough testing supplies to stay open is a critical priority for us. We've invested $10 billion of the American Rescue Plan given to states to support and stand up testing programs. We've also invested $650 million in a program called Operation Expanded Testing, which set up regional hubs of labs that schools could contract with to run their testing programs. But that doesn't work if there aren't tests available. So ASPR is working directly with states to match additional manufacturing capacity with states that need it. Not only that, we are in the process within ASPR of looking at our contracts to see if we have any additional capacity, and will commit to sending that capacity to the school programs.
Senator Burr.
Thank you, Madam Chairman. Let me just cut to the chase. Dr. Fauci, you said CDC was going to update its guidance and include antigen testing, or suggested that it would. Dr. Walensky and CDC came out with the guidance, it didn't include it. Was that part of the communications plan to start with and they diverted, or was that something you just chose to inject?
Thank you for that question, Senator Burr. In discussions about the real gray zone, which Dr. Walensky described, about after the 5 days where you have a considerable diminution in the likelihood of being transmitting, we had been in discussions about what the role of antigen testing would be. And as a matter of fact, when Dr. Walensky came out with the final guidelines, they include that if you have a test available, you may take a test. So at the end of the day, we were quite in concordance with our views.
Well, I think the chair and I share this. We found it very confusing, and I think the American people found it confusing, and I don't say it lightly when I say not too many people in America are listening to what comes out of Washington, whether it's Congress or out of the administration as it relates to COVID. So the president makes an announcement, Ms. McConnell, of 500 million at-home tests. Is this the first time that you've thought about purchasing an at-home test, or have you tried to before and it was rejected?
Thank you, Ranking Member Burr. This is the first time the administration has committed to purchasing tests to send to the American households.
So is that ASPR or is that DOD? Because of all the notifications of contracts signed, I've seen them from DOD. I haven't seen them from HHS.
Thank you for that question, Ranking Member Burr. We have a relationship with DOD for assisted acquisitions. So ASPR will request that DOD put out a solicitation or manage a contract on our behalf. They're able to do it extraordinarily quickly. And we've had an MOU in place with DOD for this work that will run through June 2023. We've used this relationship to purchase vaccines and therapeutics, and we're now using it for testing.
So the best I can find, you mentioned 50 million doses having been contracted. I can identify 27 million out of two companies, Media and Atlantic Trading. Neither one of them are manufacturers of tests, and I believe the third one, Revival, is not a manufacturer of tests. Media actually came to fame was importation of vodka and tying cell phones to vodka. And like a lot of other companies, they got in the PPE business in 2020 with some nominal FEMA contracts. Why should we have any confidence in these contracts if, in fact, we're dealing with companies that don't manufacture anything? And can you assure me that the tests that are coming in are not coming from China?
Thank you, Ranking Member Burr. Absolutely. These tests, what we initially did to be able to access tests for the initial shipments that will go towards the end of January, we worked with warehouses to see where additional tests were stored and assessed that additional capacity and are bringing that capacity to bear for these initial tests that are going out, which is why you're seeing contracts with warehouses and not with test manufacturers.
So is what you're telling me they've got 50 million tests in warehouses in the United States and all we did was access that inventory?
That is my understanding.
Well, will you confirm your understanding? This is a very, very important piece when you've got companies that don't manufacture tests, and all of a sudden we're giving them a $190 million contract for about 14 million home tests, and their expertise is importation of vodka. I encourage you to look through the list of people that we're signing up with. Are you aware that some of the larger test manufacturers in 2021 shut down lines because of the lack of purchases for at-home tests?
One of the things we did in the fall with the $3 billion investment that we made was to turn lines on and to commit to those lines for 13 months so they wouldn't be turned off again.
Dr. Woodcock, let me just, last question, Chair. Of the 15 tests that you've currently approved for over-the-counter, how many detect Omicron?
We're still working on that, but we believe all of them detect Omicron. We simply feel they are somewhat less sensitive than they were to some of the previous variants.
Of the 50 million tests that the ASPR has contracted for, how many of those tests detect Omicron?
I don't know which tests there are. We can get back to you on that.
So you haven't consulted with what we're purchasing on the 500 million. They haven't consulted with FDA to figure out whether the tests they're buying actually detect Omicron.
I believe they have. I simply don't have that list.
Okay, I thank the chair.
Senator Kane?
Thank you, Chair Murray, and to the witnesses. Dr. Fauci, can you provide us a general breakdown of what percentage of hospitalized individuals are vaccinated versus unvaccinated, and what percentage of COVID deaths are among vaccinated or unvaccinated individuals?
Thank you for that question, Senator Kane. One of the ways to answer that question would be to look at people who are in the hospital and take a look at if you are vaccinated versus unvaccinated. And if you look at vaccinated versus unvaccinated, there's about a 10 times greater chance that you'd be infected if you were unvaccinated, about a 17 times greater chance that you'd be hospitalized if you were unvaccinated, and about a 20 times likelihood that you would be dead if you were unvaccinated. So when you look at every parameter, 10 times, 17 times, 20 times, infection, hospitalization, death.
Thank you, Dr. Fauci. Ms. O'Connell, I want to ask you a question about additional vaccine development. The current vaccines against COVID, as was indicated by Dr. Fauci's answer, have been very successful in reducing deaths, severity of illnesses, and hospital admissions. However, they've had more limited success in preventing forward transmission from vaccinated individuals after breakthrough cases, and the existing vaccines are not as durable as vaccines in other areas, so we need booster shots to continue to protect against the virus. Is the administration considering supporting the development of additional vaccines that might be able to address the gaps in the current vaccine's capabilities?
Senator Kane, thank you so much for that question. Yes, absolutely. I think we all see the need for next-generation vaccines. We are also looking for next-generation antivirals and therapeutics as well. We're in the process of working with Dr. Fauci's team to develop a unified NIH BARDA research agenda and budget to address these issues, to identify candidates that might already be in the pipeline, to help support the research into candidates that are just starting in the pipeline, so we can accelerate the availability of next-generation vaccines and therapeutics.
Thank you for that. I'd like to ask you a question about access to testing, and in particular, what is the CDC doing to make sure that testing capacity is robust in rural America and also among community health centers in disadvantaged parts of the country?
Thank you, Senator Kane. So we have this program, Increased Community Access to Testing, in collaboration with ASPR as well. This is a program that has collaborated with FEMA to increase surge testing just over the holidays. We've increased federal testing sites for PCRs, 12 federal testing sites doing thousands of tests over the holiday. We also work with pharmacies. This is a collaboration with pharmacies. And in that stead, we are able to map where the pharmacies are and their social vulnerability index, and we can actually put PCR tests in areas of high social vulnerability index through all of our pharmacy partners, CVS, Walgreens, Rite Aid, and whatnot. And then we actually put tests in our community centers as well. So really a broad stretch in order to be able to get access to testing, especially among those most vulnerable. And then, of course, as Asper O'Connell mentioned, $10 billion for testing supplies to our schools, and working closely with our schools in peer-to-peer support, in technical support to allow those tests to be used well in those school settings. Thank you.
Thank you for that answer. And Dr. Fauci, one more question for you. I ask a version of this question every time we have this panel before us. What is the NIH doing right now, or what's the current status of NIH research to better understand long COVID, to look at symptoms and potential treatments?
There are several levels of activity going on. Some news since we spoke last. I had mentioned to you, Senator, that in fact there was a $1.15 billion program for studying long COVID that is now developing cohorts to look at various incidences, prevalences, pathogenesis, and potential interventions. There have been a number of awards that have been given. Most recently in September, there was an additional $470 million funding supported through the American Rescue Plan, engaging about 100 researchers from 30 institutions to get individuals together. One of the things that's really interesting that we're seeing right now is that when you look at individuals who have these symptoms that go on, as you know, and have experienced yourself for a considerable period of time, a recent study that is in the preprint stage, so it hasn't been peer-reviewed, has some very interesting information that needs to be validated and verified. It was an autopsy study in people who had varying levels of COVID, from relatively mildly symptomatic to moderately symptomatic to individuals who actually died. And when they looked at the spread of what was not necessarily replication-competent virus, but was PCR-able virus, which means you could have nucleotides that were there seems to be a persistence in multiple organ systems, indicating that even if you clear the virus, one of the possibilities, and I have to emphasize possibility because it needs to be validated, is that you don't completely clear the fragments of the virus and you have continual stimulation, not that you're infectious or that you're going to infect anybody else, but that it is still generating perhaps an aberrant response in your immune system. I underscore again, it's preliminary, it's in the preprint stage, and it needs to be peer-reviewed. But that's some of the information we're starting to gather.
Thank you very much for that answer. Thank you, Chair Murray.
Senator Paul.
Dr. Fauci, the idea that a government official like yourself would claim unilaterally to represent science, and that any criticism of you would be considered a criticism of science itself, is quite dangerous. Central planning, whether it be of the economy or of science, is risky because of the fallibility of the planner. It would not be so catastrophic if the planner were simply one physician in Peoria. Then the mistakes would only affect that physician's patients, the people who chose that physician. But when the planner is a government official, like yourself, who rules by mandate, the errors are compounded and become much more harmful. A planner who believes he is the science leads to an arrogance that justifies, in his mind, using government resources to smear and to destroy the reputations of other scientists who disagree with him. In an email exchange with Dr. Collins, you conspire, and I quote here directly from the email, to create a quick and devastating published takedown of 3 prominent epidemiologists from Harvard, Oxford, and Stanford. Apparently there's a lot of fringe epidemiologists at Harvard, Oxford, and Stanford. And you quote in the email that they, or from Dr. Collins, and you agree that they are fringe. And immediately there's this takedown effort. A published takedown, though, doesn't exactly conjure up the image of a dispassionate scientist. Instead of engaging them on the merits, you and Dr. Collins sought to smear them as fringe and take them down. And not in journals, in lay press. This is not only antithetical to the scientific method, it's the epitome of cheap politics, and it's reprehensible, Dr. Fauci. Do you really think it's appropriate to use your $420,000 salary to attack scientists that disagree with you?
The email you're referring to was an email of Dr. Collins to me. If you look at the email.
That you responded to and hurried up and said, I can do it. We got something in Wired magazine.
No. I think in usual fashion, Senator, you are distorting everything about me.
Did you ever object to Dr. Collins' characterization of them as fringe? Did you write back to Dr. Collins and say, no, they're not fringe, they're esteemed scientists, and it would be beneath me
I did not
to do that? You responded to him that you would do it, and you immediately got an article in Wired, and you sent it back to him and said, hey, look, I've got him, I nailed him in Wired of all scientific
publications. That's not
what went
on. There you go again. You just do the same thing every hearing.
That was your response. And this wasn't the only time So your desire to take
You're
down
absolutely
people.
incorrect. As usual, Senator, you are
No.
incorrect almost everything you
Well,
said.
no, you deny, but the emails tell the truth of this.
No.
This wasn't the only time. Your desire to take down those who disagree with you didn't stop with Harvard, Oxford, and Stanford. You conspired with Peter Daszak, who you communicated with privately, and other members of the scientific community that wrote opinion pieces for Nature. 5 of them signed a paper for Nature, an opinion piece. 17 signed a paper that called it conspiracy theory, the idea that the virus could have originated in the lab. Do you think words like conspiracy theory should be in a scientific paper?
Senator, I never used that word when I was referring to it. You're distorting virtually everything.
Did you communicate with the 5 scientists who wrote the opinion piece in Nature where they were describing, there's no way this could have come
That was
from the lab?
not me. What I
Did
did.
you talk with any of those
See,
scientists
but
privately?
you keep distorting
you?
the truth. It is stunning how you do
Did you talk
that.
to any of the scientists privately?
Yes.
Who wrote the opinion? You did.
Well-
What were they telling you privately?
Well, let me explain. You know, you're going back to that original discussion when I brought together a group of people to look at every possibility with an open mind. So not only are you distorting it, you are completely turning it around, as
Were
you
most of the
usually
scientists
do.
that came to you privately, did they come to you privately and say, no way, this came from the lab? Or was their initial impression, Dr. Gary and others that were involved, was their initial impression actually that it looked very suspicious for a virus
know-
that came from a lab?
Senator, we are here at a committee to look at a virus now that has killed almost 900,000 people. And the purpose of the committee was to try and get things out, how we can help to get the American public. And you keep coming back to personal attacks on me that have absolutely no relevance to reality.
Do you think anybody has had more influence
let-
over
let
our
me
response to
finish.
this than you have? Do you think
Madam
it's a great
Chair, can I-
success? Do you think it's a great success what's happened so
Right.
far? Do you think
You-
the
you have
lockdowns
said-
were good for our kids? Do you think we slowed down the death rate? More people have died now under President Biden than did under President Trump. You are the one responsible. You are the architect. You are the lead architect for the response from the government, and now 800,000 people have died.
Right.
So you think it's a winning success, what you've advocated for government?
Senator, first of all, if you look at everything that I said, you accuse me of in a monolithic way telling people what they need to do. Everything that I've said has been in support of the CDC guidelines. Wear a mask, get boosted.
And you've advocated to make it coercive and done
look
through
at
force, and
everything
you've
that I've
advocated that it
said.
be done by mandate.
Right,
You've advocated that your infallible opinion be dictated by law.
Right. So again, Madam Chair, I would like just a couple of minutes because this happens all the time. You personally attack me and with absolutely not a shred of evidence of anything you say. So I would like to make something clear to the committee. He's doing this for political reasons. What you need to do is, he said in front of this committee.
Do you think your takedown of three prominent epidemiologists was not political?
You don't want me
That
to
was my
finish because
question.
you know what I'm going to say.
That was the question. Were
Senator,
you
we
political
will-
in taking
at this-
down
at
these
this
three
point-
prominent
Senator
epidemiologists?
Paul, if you would please, I'm going to allow Dr. Fauci to respond. We have a number of senators
Yeah.
who would like to ask questions, and I would like him to be able to respond. Please do so.
So the last time we had a committee, or the time before, he was accusing me of being responsible for the death of 4 to 5 million people, which is really irresponsible. And I say, why is he doing that? There are 2 reasons why that's really bad. The first is it distracts from what we're all trying to do here today, is get our arms around the epidemic and the pandemic that we're dealing with, not something imaginary. Number 2, what happens when he gets out and accuses me of things that are completely untrue is that all of a sudden that kindles the crazies out there, and I have threats upon my life, harassment of my family and my children with obscene phone calls because people are lying about me. Now, I guess you could say, well, that's the way it goes, I can take the hit. Well, it makes a difference because, as some of you may know, just about 3 or 4 weeks ago, on December 21st, a person was arrested who was on their way from Sacramento to Washington, D.C., at a speed stop in Iowa. And the police asked him where he was going, and he was going to Washington, D.C. to kill Dr. Fauci. And they found in his car an AR-15 and multiple magazines of ammunition because he thinks that maybe I'm killing people. So I ask myself, why would Senator want to do this? So go to Rand Paul website, and you see Fire Dr. Fauci with a little box that says, contribute here. You can do $5, $10, $20, $100. So you are making a catastrophic epidemic for your political gain. So the
You
only
have
thing
politically
the only thing
attacked
that I
your
can-
colleagues, and in a politically reprehensible
The only
way, you
thing that I
attack their
can think of-
reputations.
Okay,
You won't
we-
defend it.
No,
You won't
well,
argue it.
I'm
You'll just
sorry,
simply
but
turn around the
we're going to
attack.
continue this hearing. We
Yeah.
have a number of questions from
Just
other senators.
one more minute, please.
Well,
if
Dr.
my-
Fauci, I really appreciate your response, but we do have a number of questions from senators, and we do have a second round, and I'm being asked to make sure that everybody has their time, so thank you.
Thank you very much for allowing me, Madam Chair.
We will move to Senator Murphy.
Thank you, Madam Chair. Dr. Fauci, thank you. Thank you, first of all, for what you do. You shouldn't have to put your life at risk. You shouldn't have to put your family's life at risk to simply stand up and do your job to try to protect my constituents from a pandemic disease. And thank you for calling out this agenda for what it is, an attempt to score political points, to build a political power base around the denial of science and around personal attacks on you and your family. On social media, I follow many of President Trump's advisors and family members, and they make a sport out of attacking you personally in some of the most vicious, hateful, ugly ways that are possible. And they do it because it gets clicks. They don't do it because they're legitimately engaged in an honest debate about the science surrounding COVID. Those people attack you because it gains them political followers. And so I appreciate the fact that you're willing to stand up for yourself and for your colleagues who have been dragged into the political muck, not because those that follow President Trump are interested in an honest, science-based debate about how to attack COVID, but because they see political opportunity. So thank you, Dr. Fauci, for your work, for the panel's work, and for sticking up for yourself, which is not always easy. Dr. Walensky, I want to take my time to just do a little bit of an update on best practices for schools. I know we talk about this a lot here, but part of what I think is frustrating for a lot of parents is that the guidance they're getting from their schools changes. And I get it, educators are sort of adjusting as the variant changes, as technology changes. But what has changed since the last time? Has anything changed since the last time you were here about what you are recommending for schools to stay open? I appreciate what you said in the last hearing, is that schools should be the first places to open and the last places to close. Man, as the parent of two public school kids, I couldn't agree more. The trauma on these kids during this pandemic has been significant, and the data tells us that especially for poorer kids and kids of color, distance learning just doesn't work. So I'm grateful that I've got a governor who's gone to extraordinary lengths to make sure that the federal dollars are used to keep schools open. But anything new that you can share with us about what you're recommending for schools to stay open for the rest of the year?
Thank you, Senator Murphy. And in fact, you took the words right out of my mouth. Schools should be the first places to open and the last places to close. We had a Delta surge in the fall, and 99% of our schools were safely opened. And one of the things that's majorly different between September of 2021 and today is we have pediatric vaccinations. We have vaccines that are available for every child over the age of 5, and the children who are in the hospital now are largely those who are unvaccinated. So first and foremost, one of the most important things that's changed, is we should be getting our children and our teenagers vaccinated. And if our teenagers are eligible, we have boosters available for our teenagers as well. So we saw through the Delta surge that we were able to keep our children safely in school before we had vaccines. So now today, what do we have for our children? We have vaccines, of course, that we can use. We have school testing programs. We have new science that demonstrates test to stay. This is where a child might be exposed in the classroom, but if they're exposed, they don't have to stay home in quarantine. They can test every other day or twice a week and stay in the classroom safely. And what that has demonstrated is hundreds of thousands of person days of children in school rather than at home. We have new science that has demonstrated the value of masking, 3.5 times increased risk of school outbreaks if you're unmasked in schools versus if you're masking in schools. And just this week, we updated our K-12 guidance so that it is consistent with our isolation and quarantine guidance for the general public so that people can come back to school after isolation after 5 days.
Thank you, Dr. Walensky, for that and for your commitment to keeping our schools open. Final quick question for you, Ms. O'Connell. Talking about in-home tests, obviously a lot of focus on in-home tests today, but these are antigen tests. There's some interesting research going on about the ability to make PCR tests available at home, and there's companies all over the country, including one in Connecticut, that believe that with some additional investment to bring those tests to scale, we could get PCR tests into families' hands at home for a cost that is at or below what we're currently charging or companies are currently charging for antigen tests. Is that a possibility?
Senator Murphy, thank you. We share your interest, of course, in seeing as many tests available for the American people as quickly as possible. And at BARDA have worked very closely with several of the manufacturers that you mentioned for these at-home PCR tests. We've contracted with one of them and have reached 5 million per month manufacturing capacity in contract with them, and continue to look at the others in ways that we can support them. I would also like to say NIH colleagues in a program called RADx, the Rapid Acceleration of Diagnostics, are working very closely with many of these companies as well as they go through the development stages. So we remain very committed to the work that these companies are doing and look forward to partnering with them as they begin to bring these products forward.
Thank you. Senator Collins.
Thank you. Ms. O'Connell, over the past 2 years, Congress has appropriated $82.6 billion specifically for testing. In addition, we've given the department flexibility to use other sources of funding. And yet, as you've heard repeatedly today, our frustrated constituents cannot find rapid tests when they need them. This testing crisis appears to have been entirely preventable, as is evidenced by the widespread availability of rapid tests in Europe, for example. The fact is that it appears the administration simply failed to anticipate our testing needs. As the former Assistant Secretary of Health recently pointed out, a lack of federal orders for tests between January and September of 2021 caused the manufacturers to reduce their lines and lay workers off, including at Abbott facilities in the state of Maine, where 400 workers were laid off. As a member of the Appropriations Committee, I share the concerns that have been expressed by Senators Burr and Blunt. I don't believe that we're in the position that we are in now due to a lack of funding, but rather a lack of planning. My question to you is, has any of this funding, this close to $83 billion that was supposed to be used for testing, been diverted for other purposes?
Senator Collins, thank you for this question. Testing remains a priority for this administration, and all the work we've done on testing has been to promote the priorities of expanding the number of testing sites available, expanding the type of tests that are available for use in the United States, expanding the supply of tests in the United States, and lowering the cost of tests. And we used the $47 billion that came in the American Rescue Plan. $10 billion of that went to schools, through the states to set up the school testing programs. $8.3 billion has gone to community testing sites, including for the uninsured and at the community health centers and the pharmacy program Dr. Walensky mentioned. $5 billion has gone to procure tests and supplies, and an additional $4.5 billion will go towards this $500 million that we are in the process of procuring. $29 billion has gone directly to states from previous supplementals for them to build and promote testing programs within their jurisdictions. The testing money, as you recall, was for testing, contact tracing, and mitigation efforts. And some of that, the funds have been used for mitigation efforts. For example, when children are crossing the border, one of the responsibilities that we have within HHS is to make sure that anyone who is, that the children that are unaccompanied are cared for. And we used some of the funds to test those children and then to separate them from COVID-negative children at the border.
I'm going to repeat my question because you did not answer it. Has any of that money been used for non-testing related purposes at the border?
For the mitigation purposes as well, which the legislation allowed the funding to be used for.
I will follow up with you because I don't feel like I'm getting an answer. Dr. Fauci, just last week, the president once again said that COVID-19 is a pandemic of the unvaccinated. And let me make very clear that I've encouraged vaccinations. I believe in them. But contradicting the president's statement, in Maine, our largest health system reported that absences of vaccinated staff caused by COVID-19 last week was at the highest point since vaccines became available. It's increased by fourfold. Does the message that COVID is a pandemic of the unvaccinated still hold true with the emergence of Omicron? And do you agree with the New York Times, which has twice reported that while the COVID vaccine is critical in preventing hospitalizations and death, it is less effective against the Omicron variant?
Thank you for that question, Senator. Yes, indeed, there's no doubt that the Omicron variant, when you look at the protection against symptomatic disease and asymptomatic infection, dramatically goes down to about 30%. What maintains itself, it goes up to about 70% against severe disease. When you boost, what happens is you get a rather significant reconstitution of the protection, particularly against hospitalization. So if you were to say that Omicron, or even COVID-19 as it is really a pandemic when you're talking about pandemic that causes serious disease, there's no doubt that there's an extraordinary divergence of risk between a vaccinated and an unvaccinated person. In response to the question just a bit ago when I said that if you look at vaccinated versus unvaccinated, there's a 17 times greater chance of being hospitalized and a 20 times greater chance of dying if you are unvaccinated versus vaccinated.
Thank you. Senator Hassan?
Thank you, Madam Chair, and Ranking Member Byrne, thank you to all of our witnesses for being here today and for your ongoing work. I deeply appreciate it. Dr. Fauci, I want to start with a couple of questions for you. We need to make sure that individuals who become seriously ill with COVID-19 can receive treatment and that doctors have clear guidelines on the effectiveness of each treatment for the latest variant. And you touched on this in your opening statement, but I would like you to just expand a little bit on this. In light of Omicron, how is the administration evaluating new COVID-19 treatments and monitoring the effectiveness of existing treatments?
Thank you for that question, Senator. There are a number of studies that have been conducted and that are being conducted right now, and they have to do with studies that are NIH-sponsored, one of which is the Adaptive COVID-19 Treatment Trials, or ACT, ACTT, which in fact have been from the very beginning, as early as February of 2020, was the basis for the FDA approval of the antiviral remdesivir. Other of those studies, particularly those on monoclonal antibodies, showed several of them in the clinical trials to be effective at first against Delta. We know now that a couple of them, except for one, has now lost some of its effectiveness. There's another group of studies called ACTIVE, and there are 6 of those, and that stands for Accelerating COVID-19 Therapeutic Interventions and Vaccines, and the whole gamut of oral, IV, monoclonal antibodies, direct antivirals. And as I mentioned in my opening statement, antivirals like Paxlovid and Molnupiravir, the original research had been done in the early trials by the NIH. But importantly, in direct answer to how we know what to use, the NIH has put together a guidelines panel made up of 48 highly qualified clinicians and individuals with experience in COVID-19 to give a prioritization of what you do if you're infected and with advanced disease in the hospital, as well as what you do as an outpatient. And they're fairly clearly delineated in the guidelines, which is easily accessible by just going to the NIH website and going to nih.gov and then guidelines panel. And people can get a good idea, clinicians throughout the country and the world, of how to use these antivirals. Thank you.
Thank you. I want to follow up. I am grateful that the administration heeded my call to send FEMA teams to New Hampshire to help administer COVID-19 treatments. However, the teams were delayed in arriving and are scheduled to stay only for a short period of time. So, Dr. Fauci, what additional personnel and support is the administration planning to provide to New Hampshire and other states to help treat COVID-19 patients in the most effective way possible?
Well, there are several things. Perhaps Assistant Secretary O'Connell can answer, but I can start off by saying that there are surge teams right now, at least 60 surge teams, that have been deployed to help those areas that have difficulty because of the surge and the fewer volume of cases to be able to handle them with regard to everything from hospitalizations to treatment and other implementations.
And I appreciate that Assistant Secretary O'Connell is in a good position to follow up, and I would like to follow up after the hearing. But I did want to ask one other question to Dr. Walensky. We've long had problems with accurate state vaccination data in New Hampshire. It's come to light that the CDC's data on New Hampshire's vaccination rates is also inaccurate. Apparently, the CDC can't consistently distinguish in its data between first doses of the vaccine and boosters, and as a result, the agency incorrectly records boosters as first doses, artificially raising the vaccination rate. The CDC's data is inaccurate for other states as well. We've been looking at this for other states too. So what steps is the CDC taking to resolve these data inaccuracies, and when will the CDC have accurate data for New Hampshire?
Thank you, Senator. This is a really important question. So CDC is the compiler of the data, and we rely on the state immunization services to provide CDC the data at the state level. Now, among the challenges with these accuracies is that if people don't bring in their card, they are counted as a first dose when in fact their card would have been a third dose, and we rely on the states to work to reconcile any differences if a person put in a middle initial on one card but not on another. And we're working closely with every single state to increase the accuracy. We're encouraging people to bring their cards because that also increases the accuracy. We recognize this challenge and we are working state by state, including in New Hampshire, to reconcile these inaccuracies to get them more accurate in our comprehensive reporting of every state.
Well, I appreciate that very much. Thank you, Madam Chair. I'll just say that what I'm hearing you say to the general public is it's really important to help with the accuracy of data by keeping your card, taking a photo of your card, making sure that you're sharing all your information at the site where you're getting a vaccine or booster shot.
Very helpful, yes. Thank you very much.
Thank you.
Thank you. Senator Marshall.
President Biden inherited a vaccine, a distribution plan, trillions of dollars in funding, but unfortunately this administration has chosen to put all its eggs in one basket, prioritized unconstitutional vaccine mandates and testing. Yet comparing 2021 to 2022, COVID infections have increased 72% and deaths increased 27%. This we know. If you look at this data, your current plan is not working. The current plan is not working. We need therapeutics at warp speed. Ms. O'Connell, who is responsible for this failure?
Senator Marshall, thank you for that question. We are making 6 therapies available to the American people free of charge.
Who's responsible for the failure?
Senator Marshall, we continue to make therapies available at warp speed to the American people.
The Biden administration has allocated over $80 billion for testing and only $15 billion on therapeutics. It's obvious that your plan has failed. We can't keep throwing good money after bad money. This is insanity. We have to admit our mistakes and go a different direction. Ms. McConnell, would you commit to an Operation Warp Speed for therapeutics?
Senator Marshall, thank you. Therapeutics are part of Operation Warp Speed, and that's how we have the 6 therapies that we're currently making available to states free of charge.
They'll be available after Delta is already been come and gone, and also after, of course, Omicron will be said and done as well. Dr. Fauci, 59% of Americans and 81% of Republicans do not have a favorable opinion of you. Frankly, honestly, you've lost your reputation. The American people don't trust the words coming out of your mouth. Every day you appear on TV, you do more damage than good when it comes to educating the public on COVID. Suppose you were leading a team in an effort to try to get people to stop smoking cigarettes. But every time your spokesperson goes on television, over half the nation goes out and buys a pack of Marlboros. Wouldn't you stop that person from appearing on national television?
Once again, Senator Marshall, I believe that's a real distortion of the reality. If you look at everything that I've said on TV, it is to validate, encourage, and get people to abide by the recommendations of the Centers for Disease Control and Prevention. Look at everything I've ever said.
Yeah, Dr. Fauci, I
Get
understand that,
vaccinated,
but perception
get
is
tested.
reality.
Yeah.
And you're hurting the team right now.
yeah.
You are hurting the team right now. Dr. Fauci, you previously told this committee under oath that NIH and NIAID have never funded gain-of-function research with the EcoHealth Alliance. However, a report from the Department of Defense Inspector General released yesterday states that EcoHealth Alliance proposed DARPA in 2018 seeking funding to conduct gain-of-function research on bat-borne coronaviruses. This proposal, named Project Diffuse, DEFUSE, was rejected by DARPA because the project didn't address the current research's potential to violate the gain-of-function moratorium. The proposal does not mention or assess potential risk of gain-of-function research. That's a direct quote from the DARPA rejection letter. The same proposal rejected by DARPA for gain-of-function potential was not rejected but by NIAID under your leadership. You funded Project Diffuse and its research that took place at the Wuhan Institute of Virology. Why did you tell the committee that your agency has never funded gain-of-function research? Why did your agency award this grant despite it being rejected by DARPA due to its concerns about violating the moratorium that was in place? And finally, will you commit today to release all records fully unredacted by the end of this week so Congress and the American people can know the truth about NIH's role and the origins of COVID-19?
Okay. So again, Senator, it really pains me to have to just point out to the American public how absolutely incorrect you are. What came out last night on Project Veritas was a grant that was submitted to DARPA. Then it distorted and said, we funded the grant. We have never seen that grant, and we have never funded that grant. So once again, you are completely and unequivocally incorrect. When you joined the DARPA proposal was a grant that we never saw and we did not fund. So you are incorrect, Senator.
Our social media will have all the supporting documents, and we'll be supporting these for the record as well.
You're backing down on this? Why don't we go and look at the Veritas statement? They were talking about a grant that was submitted to DARPA.
Are you saying this was not, are you saying that this was viral gain-of-function research?
I'm telling you that you're saying
Are
that
you
we
saying that
funded the
this was
DARPA
not viral gain-of-function research?
By the definition that you are very well aware.
Your P3CO definition is just a legalese to get away to allow you to do the viral gain-of-function studies.
This is what I'm talking about, Senator.
Senator Marshall, if you'll please allow the witness to respond.
Senator, we know, and the misinformation, that the guide rails for what can be done or not were not established by me. They were established by a 3-year process led by the Office of Science and Technology Policy of the White House.
And decided by you in a secret meeting at the White House in December of 2019.
Senator, that is incorrect. And this refers exactly to what I was talking about in response to Senator Rand Paul. You are incorrect completely, and every time I try to
You keep
explain...
saying you're incorrect, but the facts are on my side.
So-
Why will you not commit to sharing everything
Marshall.
open,
Senator
unredacted
Marshall.
with this Congress?
So
Senator
here's an
Marshall,
example.
Dr. Fauci, this hearing is critically important to the American people. There are millions of people infected with the COVID virus.
Right.
It is impacting every part of our economy. Every family is asking for answers to critical questions. Both sides of the aisle have asked tough questions, but we are not going to allow this committee hearing to be another personal attack that undermines our ability to deal with this terrible virus that is impacting so many people. I will then turn to Senator Smith. Thank you.
Thank you, Senator.
Thank you. Thank you, Chair Murray. And, well, I'll just let that go. So as we move into the 3rd year of the COVID-19 response, it seems to me that our strategy is shifting. We are shifting from a goal of trying to get to 0 COVID cases to eradicating the virus. And our goal is really much more about minimizing the damage of this pandemic. You and I have talked about this, Dr. Fauci, as well as with Dr. Walensky. So we need, of course, to minimize hospitalizations and deaths caused by COVID. We do that through vaccines and through therapies. We also need to minimize the COVID damage by understanding how to keep kids in school, how to keep businesses open, and how to protect against the damage that is caused by social isolation and burnout and other stresses that injures our mental health. It seems to me that while this is happening, while COVID continues to seriously stress our healthcare system, and while we still have people in this country, including, sadly, some members of Congress who continue to spread misinformation and lies about the pandemic. So it seems like we have to be realistic that these cycles of the pandemic, until it becomes endemic, are going to continue. We're going to probably continue to see some unpredictable variants arise. Madam Chair, I just want to say that I hope that this committee can find some time to discuss these issues as they relate to global vaccine strategy, because this is going to be crucial to our work to protect Americans' health as we go forward, since we are not an island. But let me ask, I'm very interested in how we think about like the data that is important for Americans to keep in their minds as they're trying to measure relative risk. Last week, public health experts published some interesting articles that suggested that we should maybe think about incorporating COVID-19 data into aggregate risk for all respiratory viruses that are circulating, including the flu and RSV. And that maybe this data, if we could look at it in real time from medical facilities and ERs and so forth, testing facilities, private homes even, would give us a better picture of what's happening. So let me ask Dr. Walensky and Dr. Fauci, if you could talk a little bit, I want to understand about this. I want to understand how you think about this question of relative risk, how we should be transitioning and what we consider from daily case counts, for example, to looking at other data, and particularly how you evaluate this idea of looking at all respiratory illnesses in one basket.
Yeah, Senator Smith, this is such a critically important question. Thank you for raising this. So we have to do two things simultaneously. Right now, we're dealing with an Omicron surge where we have the most number of cases we've ever had in a day in this country. And so we have to get out of this Omicron surge, but in the meantime, we have to look down the field and we have to understand what is this going to look like when we're not in a surge? How do we deal with endemic disease, and what do we start looking at with regard to endemic disease? And you're absolutely right. We need to think about the severity of that disease, because now with 62% of Americans vaccinated, some of that disease is not as severe as it was. That's a success of our vaccines. We have to look critically at hospital capacity. What can our hospitals handle? Because if people are coming in with COVID, or if hospital staff are out with COVID, that's a really important measure that we're going to look at. And one of the things we probably still are going to examine, although perhaps with less import, is the actual number of the cases. And why that's important in general is because it generally foreshadows what's coming into the hospital. So knowing that and understanding what that might mean for the future of hospitalizations, future severity, future capacity. And all of those are things that we're looking at right now. But one of the things that you critically mentioned was our efforts in data monetization. How do we take the efforts that we've had so far with COVID and increase them, continue to keep the pedal to the metal, as it were? When we started here, we were not collecting racial and ethnicity data. We didn't have a way to link in a personal, with personal identifiers removed, electronic health records with our testing records. We had 187 hospital systems who could do that. Now we have 10,000. So what we really need to do is scale up our data monetization efforts and do it, as you say, not just for COVID, and not just for other respiratory diseases like flu, RSV, as you note, but for all diseases. So we're looking at doing this for maternal mortality, for sickle cell disease, for opioid injury, for many, many diseases, and this is going to be the power of our data monetization efforts, and I'm really grateful for resources from Congress to be able to leverage those. Thank you.
Thank you. Madam Chair, I believe I'm out of time, but I have other questions if we have a second round.
We will have a second round. Senator Tuberville.
Thank you, Madam Chair. Thank you for being here today. This administration has been in charge of the federal COVID response for a year. I have to say, I don't think it's been a job well done. Our federal government not only sets the tone and the guidance for how millions of Americans should be handling COVID, we set the standard for the world. Our information has to be correct. I continue to hear that we need to follow the science, and I agree. But we have to yet hear the clarity from this administration. We hear conflicting guidance across the board. In order to be effective, guidance has to be understood and implemented by the average American. But most Americans can't make heads or tails of anything coming out of this administration. So we are all of us, are failing this test. One thing I do know is that when we finally, toward the end of this thing, Congress is going to have an investigation. We all know that. We've heard that the FDA and President Biden say 55 years will be needed to share data related to a lot of those decisions. But we will have to investigate. This group will have to investigate and have the information before 2076. Heck, most of us won't be here in 2076. This investigation will look into who had authority to make decisions. I know there are more people making decisions behind the scenes. So what I'd like to know is, I'm just concerned how badly the response has been. It's handled, President Biden's handled this in his first year. We've heard all the pluses and minuses. This administration took office with 3 successful vaccines and numerous effective therapeutics and basically drove the response into a ditch. At times, it doesn't seem like anyone's in charge. You started the year by dismantling Operation Warp Speed, canceling contracts for monoclonal antibodies, underinvesting in testing, and we've spent billions in that, first with Delta, now Omicron. People can't find a test. I'm getting texts as we speak, sitting here, where do I get a test? We spent billions on this. If we can't find a test and test positive, they can't get treatment. Monoclonal antibodies are rationed, antiviral pills are months away. So I just got a simple question. Of all of you up there, and whoever wants to answer this, if you have a problem and you're coordinating, who do you go to? Who is the head coach of this virus that you have to go to, whether it's in the administration, whether it's one of you? Dr. Fauci, who do we go to?
The person who's in charge of that is Jeff Zients, who
In
is
the White House?
At the White House. And we meet very, very regularly, the entire medical team as well as others, going over all of the data, going over what the strategies are, going over what the issues are, what the problems are, what we've done right, what we've done wrong. We examine it literally continually, sir.
Has he done a good job?
I think given the circumstances that we're in right now, I believe he's done a very good job. I really do. This is an extraordinary virus, the likes of which we have not seen even close to in well over 100 years. It is a very wily virus. It has fooled everybody all the time, from the time it first came in to Delta to now Omicron. Very unpredictable, and we're doing the best we possibly can.
Yeah. Dr. Walensky, it's been reported by some virologists and scientists that this year around 170 people have died from taking the regular flu vaccine. The Vaccine Advisory Adverse Reporting System reported that the number of people dying after or following the COVID vaccine is actually in the thousands. Now, this is what I'm hearing. I'll give you a chance to refute that or confirm it here. Is this true? Are we having that many people die after taking one of these vaccines?
Senator Tuberville, thank you for that question. The Vaccine Adverse Event Reporting System is a mandatory system of any adverse event that happens after being vaccinated. So if you get hit by a car tragically after getting vaccinated, that gets reported in the Vaccine Adverse Reporting System, the VAER system. So the vaccines are incredibly safe. They protect us against Omicron. They protect us against Delta. They protect us against COVID. They don't protect us against every other form of mortality out there.
Do we keep numbers of people that died following taking a COVID test from taking this vaccine? Do we have any idea? I'm just asking.
I'm sorry, those who have died after taking a COVID
Died following
test?
taking the vaccine. Is there any number count? Do we keep records on that died of just from?
Absolutely, yes. I couldn't give you the absolute number off the top of my head, but our staff could absolutely get back in touch with you. We collect those data.
You know, Dr. Fauci? You have any clue on that?
About how many died after?
100?
I don't know the number, but I think it's really important for people.
You can turn on your
Microphone.
I'm sorry. I don't have a number, but I think part of the confusion is that when you do a reporting, if you get vaccinated and you walk out and get hit by a car, that is considered a death. I mean, that's the thing that gets confusing, that everything that happens after the vaccination, even if you die of something completely obviously unrelated, it's considered a death. So if I had metastatic cancer, got vaccinated, and died 2 weeks later, that's a death that gets counted.
I understand that. Yeah.
And every one of those is adjudicated.
Yeah. One quick question before we get through here. I'm in rural Alabama, but I get one of these home tests, and I test positive. I have asymptomatic. What do I do? People call up, what do I do? I don't have a doctor around. What do I do?
Thank you. So you're asymptomatic?
Pardon?
You're asymptomatic, no symptoms, feel well?
Yeah.
You stay home for 5 days, and the next 5 days, if you continue to be asymptomatic, you can go out, wear a mask, don't go traveling, don't go to gyms, don't go
But I get real
restaurants.
sick, then what do I do?
then, well, first you go and call your physician, and in fact, I'd say you call your physician regardless, but call your physician, call your provider. If you're continuing to have symptoms, then you stay home until your symptoms resolve.
No therapeutics.
Yeah,
Well, that's where I would say call your physician and see if you're eligible for therapeutics.
A lot of these people don't have physicians.
and
They've got a drugstore.
Senator, we do
Thank you.
need to move on.
Thank you.
Senator Rosen.
Thank you, Madam Chair. Thank you, Ranking Member Burr. This hearing is so very important. I really want to thank all of the witnesses here for testifying today. Your continued work, thank you so much as we combat this pandemic in real time, And so first, I just do want to echo the concerns my colleagues have raised about access to testing, both in-person PCR tests and the at-home rapid tests. We do know that home test kits are scarce. Americans are standing in extremely long lines to get a COVID test, and hospital emergency departments in my home state of Nevada have seen a significant increase in people coming solely for tests because there just aren't enough alternatives. And so this is just really only adding to the stress, as again, I can say, speak to Nevada, on our health systems. Nevada's been expanding our testing options, but increased federal support on the ground in addition to home testing, we feel is absolutely critical. And in the future, the federal response must be more proactive in this space. And so I'm a little bit concerned about the testing keeping up with the variants, because this is all happening in real time. COVID is evolving. You don't know which strain may become the dominant strain. And so we want to ensure, just in addition to the effectiveness of the vaccines and therapeutics, that the testing accuracy must also keep up. So Dr. Fauci, with some recent reports about the current variant settling more in the throat than in the nose for some patients, what are we doing with the development and deployment of rapid at-home tests based on saliva versus a nasal swab? And then, Dr. Woodcock, how rapidly do you think the over-the-counter testing can be delivered, approved, looked at, approved, delivered to the American public to make sure that they're less anxious?
Thank you for that question, Senator. Yes, there have been recent reports that, in fact, the sensitivity and the ability to detect in a swab of the throat versus the nasopharynx, at least with Omicron. That's a preliminary report. I think it needs to be validated and verified. If the data are strong enough, then the company, whatever who makes that, will likely go to the FDA to ask to change the indication because the emergency use authorization is for a nasal swab. If the scientific data indicate that it's better to get an oral or other swab, they would present that to the FDA. So I would leave that to Dr. Woodcock to answer the rest of that question.
Thank you.
Certainly. Well, we can act very rapidly, but first I would like to say people should not use swabs that are designed as nasal swabs and try to swab their throat. They may stab themselves, okay? That would not be good, okay? What we need to do is have tests that, see whether the throat swab, as Dr. Fauci said, could provide more sensitivity. We do know the tests are picking up Omicron, but right now with less sensitivity than they did some of the other variants. As far as time, as I said, after the ITAP program does the testing at NIH, FDA has been able to authorize within a day or two of getting those data. However, the companies would have to change the test configuration to accommodate the swab, the larger swab that you'd use in the throat. That's probably what would take the most time, as well as seeing whether that was better.
And to continue with that point, as we've seen with some of the testing, the reagents or the materials that it really takes to use the test, is there the ability for people to return a test that might no longer work? Can those agents, any of that, be recycled or upcycled if they're returned to the company unopened? Like, how do we not dispose them and not get some recyclability out of that? Is that possible in some way?
We can get back to you on those parameters. Be happy to do that.
Thank you. I appreciate that. I'd like to talk a little bit again. People are talking about the public health data. you know, we're noting about all the daily statistics, we're noting about some of the statistics about possibly death. And so positive or negative, critical, this data is critical even for us to make our decisions as far as what we fund. And sometimes there's notes to say that we shouldn't include home testing in the daily statistics because they might not be reliable. So Dr. Walensky, to build on some of that testing and the statistics that you need to do your job, that all of us need to do our job, how is the CDC working with the state, local health, our hospitals, to be sure that the voluntary self-reporting guidance it is going to be accurate and give us the kind of statistics we need going forward?
Yeah, thank you for that question, Senator. So we are routinely reporting PCR tests. That is what is routinely reported from the state, and that is what our updated statistics are. There's passive reporting that occurs with rapid tests, but I also want to understand the importance of rapid tests, at-home tests, for people to be empowered to use these rapid tests to do the right thing. Mm-hmm. So regardless of whether we can count them, generally they tend to be people who have milder symptoms. They might have been vaccinated, have a runny nose, and they decide to go and get a rapid test and do the test at home. Less important is counting that case than it is that that person stay home, isolate, do the right thing, and not be forward transmitting. So I think that many of these tests have different purposes, but one of the really important purposes of these rapid tests, even if we don't count them, is to empower the public to do the right thing through this pandemic.
Thank you.
Thank you very much.
Senator Romney.
Thank you. Thank you, Madam Chairman. Just a couple of thoughts. One, it's been 2 hours since we've been here. It's one of the people at the low level here out in the hinterlands. Just a couple of thoughts. One, I think it would be helpful if and please excuse me for this comment, if the chair and ranking member limited their opening comments to the 5 minutes, just like you expect those folks to limit their comments to 5 minutes. We didn't get started until 25 minutes after asking these folks their questions. I do want to note also that in this process, as I'm sure you who are testifying here today recognize, that some of what we do is performing, and some of what we do is to become informed. And I do both from time to time, so I'm not just in one camp or the other in that regard. But I do want to point out how much I personally, and I believe the great majority of the people in our country, respect you individually and professionally for the work that you do. You are scientists, not politicians. Nevertheless, you are being made subject to the political whims of various political individuals, and that comes at a high cost, which unfortunately I fear will lead some to not want to participate in helping our government make scientific choices. But I very deeply appreciate your commitment to the American people and your desire to do things as well as we possibly know how to do. That doesn't mean they will be done perfectly. That doesn't mean you won't make mistakes. Doesn't mean there won't be changes from time to time. Sometimes as data comes in that's different than what you had anticipated, and sometimes